Hi, this is Kirk, the Bariatric Carnivore. Well, let's talk about how to avoid being medically bullied. Yeah, your doctor can bully you and try to force you into some stuff that you may or may not want. And let me give you a couple of recent examples. I don't have very many of late because I've been pretty much avoiding the medical system. But there's a couple of things I haven't been able to avoid. One of them is this. When I was about 46 years old, I had blood test showed I had extremely low blood testosterone. And doctor recommended going on testosterone replacement therapy. Now, at that time in my life, I was very overweight and not exercising regularly and eating a pretty crappy diet under some ridiculously high stress. Those things should have been fixed first before I started taking testosterone replacement therapy. Unfortunately, I just took the shots. So I've been giving myself shots for a long time. I'm 61 years old. And about 8 months ago, I went into the doctor to go get that renewed. And I noticed something rather interesting. They do two measurements of your testosterone. One is, after you've taken your last shot, and they take it at the high level mark, and then they do what they call the trough, the low mark, after a week or so with no testosterone in your system. And I noticed that my testosterone level at this point in my life, where I've gotten much healthier, was at least 2 times higher than what would be considered low. And I'm sitting there looking at it going, wait a minute, why am I still taking this? I am now much healthier than I was when it was low, when I started this thing. Why am I adding artificial testosterone to my system when it's really not needed? And the doctor bullied me. He told me that, look, there's all these horrible health effects that can come from low testosterone, and the higher, the better, and, you're going to have all these side effects, but, if you don't want to do it, that's fine with me, but, frankly, you need to do it. Every instinct in my body said, stop it. But I got bullied. That's on me. That was my mistake. Okay. So I continued with it. Fast forward a little bit later, just a few weeks ago, I'm in the hospital with a blood clot in my lung. It's serious. I mean, a blood clot in your lung kills about a third of the people that had it. Mine was serious. It was so bad that they had to shock the right valve to get it back in the rhythm. I had a resting heart rate over 150, and I was just swollen with about 40 pounds of fluid in my system. It was bad. Well, we get it back in the rhythm. I'm feeling better. Just to give you an idea of just how much healthier I am now. They shock my heart on a Thursday, Friday morning. I'm driving myself home. Okay, so it's not that huge of a deal once things got stabilized. Now, why do I bring that up? Well, the doctor came in and asked, okay, what could have caused this blood clot? Because they start in your legs. So have you been just laying in bed, not moving? Nope. Work out regularly. How about long plane flights? Did you fly to Europe or anything like that? No. It's been 2 years since I've taken a flight to Europe. Any injuries? No. Okay, they checked with an ultrasound to see if there's any tumors or anything like that. No. Matter of fact, there's no blood clots in the leg anymore when they did the ultrasound. So that ain't there. So what could have caused it? Well, what was interesting was what they didn't ask. There's been some stories that people have gotten some pretty mysterious blood clots from getting COVID vaccines. And you'd think they might have asked if I'd gotten a booster or anything like that lately. And I would have told them, frankly, no, I never even got the first COVID shot. So I didn't get any of the COVID stuff. So, what else could do it? Do you ever do testosterone replacement? Well, yeah, actually, I just quit a few weeks ago. Well, apparently it didn't stop soon enough. So apparently I'd stopped it early enough to keep the clots from getting, to get rid of the clots in the leg that were there. But one of them had lodged into the lungs, and that's what caused it. Okay, Lesson learned, I shouldn't have been bullied back then. So I go to the cardiologist for a follow-up. This was truly an amazing case of an additional medical bullying. Number one, they tell me, hey, we want you to go on these blood thinners and we want you to stay on them for the rest of your life. These are drugs that cost $600 a month, roughly $7,000 or so a year. And I'm sitting there going, why? Why do I want to pay $7,000 a year? Well, because you've had a blood clot and you might get another one. Well, we know what caused it, and I'm not taking that testosterone anymore. So why would I continue doing it? Well, you might get AFib. Well, AFib is a fluttering, irregular heartbeat in the left valve. My irregular valve was the right side, the one that hooks to the lungs. That was not the problem with AFib. Matter of fact, they had me hooked up to every cardiological device known to man for 2.5 days. Now, I asked them, were there any signs of AFib? No, but you might develop it. I'm not spending $7,000 a year for something that may be a problem, but is proven not to be. That is just idiocy. But, out of abundance of caution, they're just saying, hey, there's really no known side effects. Well, that's exactly what they said about the testosterone, too. Frankly, there are side effects that come with some of the blood thinners. Excessive bleeding and brain bleeds. I'm not taking a drug that has zero side effects for something that is frankly not called for because there's no reason for it. There's no AFib, and the blood clots are gone in the legs. Blood thinners do not thin out a blood clot. They only can help prevent it from getting worse, but there's no sign of it getting worse because there's no blood clotting or pooling in the legs. Why am I taking a $600 a month drug for that? Okay, that's number one. Number two bully move was you need to be on a statin. Why? Because your blood cholesterol was high. Well, frankly, I went into the emergency room and they drew my blood that they are saying that I need a statin on, non-fasted. So it wasn't even a good blood draw to check LDL cholesterol. Frankly, that is not the time to be checking it, to make a diagnosis of high cholesterol. My body's under extreme stress. It's probably producing a lot of cholesterol for a reason at that particular moment. So that is not exactly a problem. Number three, high LDL cholesterol is not a disease. Atherosclerosis, hardening of the arteries, that's a disease. How does that happen? Well, usually because you have a lot of inflammation in the arteries. Gosh, what causes that? High glucose levels. I don't eat any carbohydrates. I don't have any inflammation. All my inflammatory markers were really low. But this is where the big bully lie came in. She said, oh, your LDL cholesterol is a plaque. And that's not true. A plaque is what forms in your arteries when there's damage to the arteries. When the endothelial level gets cracked, the body kind of spackles over it by creating the plaque. Part of that plaque that forms over it includes LDL cholesterol. The LDL cholesterol is what's helping to repair damage. It is not the cause of it. You do not clog up your arteries because you have high LDL. You have clogged arteries because you have damaged, inflamed arteries. And anybody that's been paying attention to this stuff knows that to be true. But how many people know that? How many people have been bullied into taking statin drugs for the rest of their life because they conflated LDL cholesterol with plaques? And that's just flat out not true. If it was the case, then you would have plaques not only in your arteries, but also in your veins. If cholesterol itself caused plaques, why aren't there any in your veins? They're only in the arteries. As a matter of fact, you can cut out a vein, put it in a clogged artery, and replace it with a graft, and that vein behaves exactly the same as an artery, and it will get clogged in the artery if you don't change the diet and the lifestyle. So, LDL does not cause the clotting. The LDL gets there because of the inflammation, and that's caused by diet and lifestyle. But just to kind of further prove the point on this whole statin thing, I asked her a very interesting question, because I've been studying this thing for a while. And I asked her, how much of the LDL that your liver creates makes its way to the brain? And she said, that's where all the LDL comes from. And that's not true. See, the LDL that your liver produces does not cross the blood-brain barrier. Your brain produces its own LDL. The danger of statins, to me, more than anything else, is the statin, unfortunately, does cross the blood-brain barrier. And there's some really interesting studies that have come out that showed that people that have dementia and cognitive impairment, when they come off their statin drugs, get a lot of their cognitive abilities back, because statins prevent the brain from making LDL cholesterol. That is the biggest repository. Your brain has a lot of fat and a lot of LDL, and it's not producing as much as it needs because of those statin drugs. I think they're dangerous, and I've taken one before. Back before, when I was just beginning the low-carb journey, I'd done some blood work, realized that my inflammatory markers were high. I went to the doc, said, hey, how about a statin drug to reduce the inflammation? He was like all in favor of it. So I took the statin for a couple of days. I got the worst leg cramps. My calves, my hamstrings, everything just knotted up almost within 24 hours of taking the damn things. I've never touched them again. I mean, some people get some horrific side effects from statin drugs. I was not getting the anti-inflammatory, but I was certainly getting all the worst side effects, and I won't touch them. But she wouldn't ask about that. She wouldn't ask if I've ever had taken them and had problems. She just wanted to reduce the LDL, which is just a number. It's not a disease. But that's what you get in the medical system. So, how do you avoid medical bullying? Well, I think there's only one way and one way only. Be healthy. Get out. Frankly, I don't think any of these guys... I mean, look, I am a big believer that our medical system is absolutely phenomenal at taking care of acute problems. When you've got an auto wreck, when you've fallen off a ladder, when you're cut up and you're bleeding, you've been shot, etc., the American medical system is fantastic at taking care of that acute trauma. Better than any place in the planet. But as far as getting you healthy, no, they're not getting you healthy. She was giving me all the wrong advice. And one of the reasons why is because medicine is siloed. I kept looking around. I kept trying to figure out, why aren't these people concerned about metabolic disease? Why aren't they concerned that almost all their patients are type 2 diabetics? And it dawned on me, that's not what they do. They work on cholesterol and hearts. Endocrinologists, those are the people that deal with diabetes. They're the ones who prescribe the insulin. But they're not, the endocrinologists are not seeing the heart disease. None of these guys are talking to each other. And that's kind of the problem with the system. It's not designed for your health. It is designed, frankly, to sell more pharmaceutical drugs. The docs, your doc may be very well meaning, but they're not making you healthy. Look at their advice. I mean, they're more than willing to give you drugs, but are they trying to give you advice on how to get healthy? Are they asking you about your diet, exercise, sleep? Frankly, nobody in a heart hospital asks me about any of that stuff. They're not going to get you healthy. They can fix you up though. And, you know, if you recognize that that's what they can do, that's what they can do. But don't expect them to get you healthy. That's on you. Because in this fight for our health, we are all alone. But we can all be alone in this together. So this is Kirk, the Bariatric Carnivore. I try to put out a couple messages each week. If you like this message, please hit the like and subscribe. And join us in this journey to try to get healthy, get the heck out of the medical system, try to keep out of the clutches of big pharma and all the forces that are trying to really just get you dependent on them, not to get you healthy. I will talk to you again soon.